RadTech's front line in the coronavirus outbreak spreading globally. Radiologic technologists are at the front line in the coronavirus outbreak. Chest x-rays are one of the first tests prescribed by doctors when dealing with a respiratory illness. Since no diagnosis has been made, the x-ray techs have no idea they are imaging an infected patient. We see it with tuberculosis patients all the time. An order for a patient staying up on one of the hospital floors comes across our computers. Reason for exam, follow-up TB. Then we realize we did an x-ray on that patient in the emergency room 12 hours ago. Our universal precautions training is to wear gloves, not masks. Well, now what? An ongoing outbreak of coronavirus disease 2019, or COVID-19, caused by SARS-CoV-2 started in December 2019. It was first identified in Wuhan, the capital of Hubei, China. As of February 25, 2020, around 80,149 cases have been confirmed, including in all provinces of China and more than 24 other countries. Of these, 11,569 cases were classified as serious. There have been 2,701 deaths attributed to the disease, including 38 outside mainland China, surpassing that of the 2003 SARS outbreak. More than 27,000 people have since recovered. The virus is primarily spread between people by small droplets produced during breathing or coughing. The time between exposure and symptom onset is typically 2 to 14 days. Symptoms may include fever, cough, and shortness of breath. Complications may include pneumonia and acute respiratory distress syndrome. There is no vaccine or specific antiviral treatment, with efforts typically aiming at managing symptoms and supportive therapy. Hand washing is recommended to prevent the disease. Anyone who is suspected of carrying the virus is advised to monitor their health for 2 weeks, wear a surgical mask to limit the spread, and seek medical advice by calling a doctor before visiting a clinic. A large response, both in China and globally, followed an increase in cases in mid-January 2020, bringing travel restrictions, quarantines, and curfews. Examples include the quarantine of the cruise ship Diamond Princess in Japanese waters, the curfew of over 780 million in China, a voluntary curfew in Daegu, South Korea, and the curfew of a dozen towns with over 50,000 people in the Lombardy and Veneto regions of Italy. The outbreak has been declared a public health emergency of international concern by the World Health Organization. Airports and train stations have implemented body temperature checks, health declarations, and information signage in an attempt to identify carriers of the virus. A number of countries have issued warnings against travel to Wuhan, Hubei, and China generally. Among the wider consequences of the outbreak are concerns about potential economic instability and political fallout, such as the firing of several local leaders of the Chinese Communist Party for their poor response to the outbreak. Outbreak-related incidents of xenophobia and racism against people of Chinese and East Asia descent have been reported in several countries. The spread of misinformation and disinformation about the virus, primarily online, has been described as an infodemic by the WHO. Let's do a deep dive on the origin. In late December, a cluster of pneumonia cases of unknown etiology was reported by health authorities in Wuhan, Hubei Province, People's Republic of China. The initial cases mostly had epidemiological links to the Hunan seafood wholesale market, and consequently, the virus is thought to have a zoonotic origin. The China CDC reported in early January that the causative agent was a novel coronavirus, now called SARS-CoV-2, which is closely related to bat coronaviruses, pangolin coronaviruses, and SARS-CoV-1. Evidence shows that the transmissibility of the coronavirus is sufficient for sustained community transmission, and locally acquired cases have been reported across the world, along with thousands of deaths. The death toll is rising. As of February 25th, 2,701 deaths have been attributed to the COVID-19. According to China's NHC, most of those who died were older patients. About 80% of deaths recorded were from those over the age of 60, and 75% had pre-existing health conditions, including cardiovascular diseases and diabetes. The case fatality rate has been estimated at around 2 to 3%. The first confirmed death was a 61-year-old man on January 9, 2020, who was first admitted to a Wuhan hospital on December 27, 2019. The first death outside of China occurred in the Philippines when a 44-year-old Chinese male citizen developed severe pneumonia and died on February 1st. His companion, a 38-year-old Chinese female citizen, was also confirmed to have contracted the virus but eventually recovered. She stayed in the same hospital in Manila as her companion until her discharge on February 8th. On February 8th, 2020, it was also announced that a Japanese and an American died from the virus in Wuhan. They were the first non-Chinese killed by the virus. The first death outside of Asia was confirmed in Paris, France on February 15, 2020, when an 80-year-old Chinese tourist from Hubei died after being in hospital since January 25th. On February 19, 2020, two elderly Japanese citizens who had been on the Diamond Princess died after being hospitalized for a week after they had tested positive for the virus, while a third elderly Japanese citizen died on February 23, 2020. As of February 24, 2020, the highest COVID-19 death counts outside of mainland China were 12 in Iran, according to the Iranian Ministry of Health and Medical Education, or 50 in Guam alone, according to a member of the Iranian parliament, Ahmad Amirabadi Farani, 7 in South Korea, and 7 in Italy. Here are the signs and symptoms. Most infected people will initially show clinical symptoms, often described as flu-like symptoms, such as fever, coughing, breathing difficulties, fatigue, and myalgia. Further development can lead to severe pneumonia, acute respiratory distress syndrome, sepsis, septic shock, and death. Upper respiratory symptoms such as sneezing, a runny nose, and sore throat are less frequent. Some of those infected may be asymptomatic, returning test results that confirm infection but show no clinical symptoms. So researchers have issued advice that individuals with close contact to confirmed infected patients should be closely monitored and examined to rule out infection. The incubation period is estimated at between 2 to 14 days. One study found that the usual incubation time was 3 days, but maybe as long as 24 days. Here's how it spreads. COVID-19 is primarily spread between people via respiratory droplets produced when an infected person coughs or sneezes. However, the virus can also be spread by people who do not show symptoms. Coronavirus droplets only stay suspended in the air for a short time, but can stay viable and contagious on metal, glass, or plastic surface for up to 9 days. Disinfection of surfaces is possible with cheap substances such as 62 to 71% ethanol applied for 1 minute. Chinese public health officials suggest extra caution for aerosol transmission in closed rooms and recommend regularly exchanging air. On February 13, 2020, the director of the Centers for Disease Control and Prevention of the United States confirmed asymptomatic transmission. However, as of February 27, 2019, the extent to which asymptomatic transmission can occur remains unclear. Viral RNA was detected in stool specimens collected from the first confirmed case in the United States, though it was unclear if enough of the infectious virus was present to suggest fecal-oral transmission. Of the initial 41 cases, 2/3 had a history of exposure to the Hunan seafood wholesale market. There have been estimates for the basic reproduction number, or the average number of people an infected person is likely to infect, ranging from 2.13 to 4.82. The virus has reportedly been able to transmit down a chain of up to 4 people so far. This is similar to severe acute respiratory syndrome related coronavirus SARS-CoV. What you need to do for prevention. To reduce the chances of infection, health organizations recommend avoiding close contact with sick individuals, frequently washing hands with soap and water, not touching the eyes, nose, or mouth with unwashed hands, and practicing good respiratory hygiene. Those who may be infected are advised to stay at home except to get medical care, call ahead before visiting a healthcare provider, wear a face mask, especially in public, cover coughs and sneezes with a tissue, regularly wash hands with soap and water, and avoid sharing personal household items. No vaccine currently exists. A number of governments advise against all non-essential travel to mainland China. The government of Hong Kong warned anyone traveling outside the city to not touch animals, to not eat game meat, and to avoid visiting wet markets, live poultry markets, and farms. There is no evidence that pets, such as dogs and cats, can be infected. For healthcare providers taking care of someone who may be infected, you should use standard precautions, contact precautions, and airborne precautions with eye protection as recommended. Hand washing. Hand washing is recommended to prevent the spread of coronavirus. The CDC recommends that individuals wash hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Always wash hands with soap and water if hands are visibly dirty. The CDC, NHS, and WHO also advise individuals to avoid touching the eyes, nose, or mouth with unwashed hands. Coronaviruses can survive and remain contagious on metal, glass, or plastic surface for up to 9 days. Methods to remove the virus from surfaces include chlorine-based disinfectants, 75% ethanol, peracetic acid, and chloroform. Respiratory hygiene. Surgical masks used by people in Guangzhou. Masks are not recommended for people at low risk of infection. Those who suspect they are infected should wear a surgical mask, especially when in public, and call a doctor for medical advice. By limiting the volume and travel distance of expiratory droplets dispersed when talking, sneezing, and coughing, masks can serve a public health benefit in reducing transmission by those unknowingly infected. If a mask is not available, anyone experiencing respiratory symptoms should cover a cough or sneeze with a tissue, promptly discard it in the trash, and wash their hands. If a tissue is unavailable, individuals can cover their mouth or nose with a flexed elbow. Masks are also recommended for those taking care of someone who may have the disease. Rinsing the nose, gargling with mouthwash, and eating garlic is not effective. The WHO advises the following best practices for mask usage. Place mask carefully to cover mouth and nose and tie securely to minimize any gaps between the face and the mask. While in use, avoid touching the mask. Remove the mask by using the appropriate technique. Do not touch the front, but remove the lace from behind. After removal, or whenever you inadvertently touch a used mask, clean hands by using an alcohol-based hand rub or soap and water if visibly soiled. Replace masks with a new, clean, dry mask as soon as they become damp or humid. Do not reuse single-use masks. Discard single-use masks after each use and dispose of them immediately upon removal. Healthcare professionals interacting directly with people who have the disease are advised to use respirators at least as protective as the NIOSH certified N95 EU standard FFP2 or equivalent, in addition to other personal protective equipment. There is no evidence to show that masks protect uninfected persons at low risk, and wearing them may create a false sense of security. Surgical masks are widely used by healthy people in Hong Kong, Japan, Singapore, and Malaysia. Surgical masks are not recommended by the CDC as a preventative measure for the American general public. The use of masks by healthy members of the public is not recommended outside of China.